Hello, everyone. Hello, everyone. My name is Matthew Matos, and this is my presentation on my research project. I just wanted to start by saying that I really enjoyed this research project. I think at the very beginning of the class, I was like, oh my gosh, research. Um, and I didn't know anything about research. And I will say I actually learned a lot, and I put a lot of effort into this paper. And I think I was really into the paper or the research because um, I chose a subject that was that meant something to me, if that makes any sense. Because at the hospital where I work at, um, is oh, and let me back up. I chose to do my research on hand hygiene accessibility. The hospital where I work at, they have the sanitizing stations across the room from where you enter the room. So you have to walk across the room to hand sanitize and go back to that spot to hand sanitize when you exit. And it's a huge pain in the butt. And I've brought it up with management, and they're actually going to be changing it. So that's why it meant a lot to me to kind of find out this research and go from there. So here we go. Um, and that kind of explains what we're talking about, and this is my uh, question here. The dispensers are positioned inside the patient's room, away from the entrances. Um, and I list some reasons why it's important there, just because healthcare associated infections. I feel when nurses are rushed and they're busy, and if the sanitizing station is across the room, not near the entrance or the exit, we're going to miss opportunities there. So it's been proven that hand hygiene is the most important effective way to prevent hospital-associated infections, and compliance among healthcare workers remains inconsistent. Okay, so yeah. My PICO question is, among healthcare workers in hospitals or clinics, does placing hand sanitizer dispensers near patient room entrances and exits compared with standard or less accessible placement improve hand hygiene compliance and reduce associated infection rates? Which we'll talk about that. And there's my PICO question broken down. Healthcare workers in hospitals as the population, intervention, hand sanitizer stations near patient entrances compared to not being near the entrances. And hopefully the outcome is increased hand hygiene. Some of the databases I searched were the CINAHL, the PubMed, the Medline, and I used the I believe the Cochrane Library. I used the St. Mary's Library quite a bit, and whatever I think that led me to a lot of these. But in some of my search criteria was just hand hygiene, dispenser location. Then I just did the healthcare associated infections, infection prevention, and there's also a thing called electronic hand sanitizers. I was not aware of this, but I guess they're used quite a bit as well. So what we found was that if you increase the accessibility, it will improve hand hygiene compliance. So a fun fact here from the World Health Organization or anyone else, there is no standardization of where or how to place hand sanitizer dispensers, which I find pretty odd. But what they have found was that if you place hand sanitizer dispensers, they called it the point of care, which is one by the patient bed, and then one on the entrant before you enter the room, and then one inside the room before you exit. So the entrance, so actually on both sides of the wall, the door, entrance and exit, and then another sanitizing station over by the patient is to be considered well covered, but there was no standard. But getting back to the evidence, if you did place dispensers near the door, at least by the doors, you increased sanitizing efforts and compliance, and which I found not expected. Not expected. I expected that. So I don't know, the implementation plan. You know, we at my facility at least, I think we need additional. I think we need a lot more sanitizers. We can, yeah, we can place them by the patient. We can place them on the entrances and exits. We need some in the hallways. We need some. Well, we need some more in the hallways. We need some at the nursing station. We need a lot at our hospital, and it's you know, my DOM have said that they're working on it, but I want to just kind of investigate a little bit more and see what their plans are for that. But yeah, so the implementation plan would be to do all these things, but also to monitor compliance. And there wasn't really good studies on how to do that, except through observation, which not everyone has time for, and evaluating infection rates, which can be difficult because you don't know where the infection is coming from, whether it's inside or outside of the hospital. But this is my implementation plan. Expected outcomes, of course, we're going to improve hand hygiene compliance. We're hoping to have fewer missed hygiene opportunities. And that was the thing, you know, if you're in with a patient and you're busy and you just start heading for the door for your next patient, the sanitizer should be right there and just be like a ding, ding, ding as a reminder, hey, let's do this. Yeah, that's that I would think would hopefully lead to fewer missed hand hygiene opportunities. If you're going to hygiene more, you're going to reduce your hospital associated infection rates. If you're going to, and you're also going to improve patient safety. But you know, one thing that they didn't mention that's just popped in my brain, you know, your hand hygiene more, you're going to protect yourself. You know, last thing us nurses want to do is catch some of these diseases that come into the hospital. And that's, I know that's on my mind a lot of time when I hand sanitize at work is I don't want to get this, so I'm gonna clean up. And all of this equals better compliance with based on evidence-based practice. So the conclusion: hand hygiene remains one of the strongest and simplest ways to reduce hospital-associated infections. Accessibility is a significant barrier to compliance, but yet accessibility can also be your friend. Small environmental changes can lead to meaningful improvements, and evidence supports placing hand sanitizers dispensers where they call it in the workflow, where healthcare workers naturally enter and exit the room. So that's all I got. Thank you guys for looking over this, and I've enjoyed class with you, and hope you guys have a great day.